Hello and welcome. This is Jim Karp with Raymond. I have Don McAnally with me. Don, how are you today?
Hey, Jim, I'm doing fantastic. Hope you're doing well, too.
Great. Don, we're talking about healthcare here, and you've been the director for the healthcare team for a long time. Can you share a little bit about yourself and your history? Then we'll get right down to the topic.
Sure, Jim. My name, again, is Don McAnally. I'm a CPA with Raymond, been in the healthcare group for about 20 years, focusing only on medical, dental, veterinarian practices during that time frame. Help them in all different aspects of business planning, and most recently just been working, it seems like, nonstop on the COVID-19 issues.
Absolutely. So let's talk about COVID-19. It's very fluid at the moment. There's a lot of changes happening. What are the most important topics today that your clients really want to know?
Jim, it certainly is been a very fluid environment for virtually all of our clients, especially those that are in regulated industries, much like healthcare. We're trying to advise our clients the best we can with really an ever-changing environment that doesn't just seem to change day by day. It really seems to change hour by hour, sometimes minute by minute. But there's a variety of issues that I think our clients within healthcare really need to be aware of. One of the key issues that I think people need to be aware of is that management of their cash flow is significant right now. Many practices need to understand that their cash right now is really the king in operating their practice. This too shall pass, but we need to make sure we have cash flow to help sustain ourselves through it. So some of the things that we've been talking to clients about, Jim, is really taking a look at delaying payments on accounts payable. Okay, that's a tough one to do. Most medical practices kind of pride themselves on how well they manage their businesses and how they manage their finances, and paying their vendors is part of that. But right now, you might need to take a look at your payment terms. If you're regularly paying things in 10, 15, 20 days, you might want to stretch that out a little bit to help manage that. Contacting your bank. I think that medical practices really need to make sure that they contact their bank and really take their banker in as a strategic business partner. Talking to them about their situation, where they stand, how they stand, and what they might need. Take a look at your banker to make sure you've got lines of credit in place. And if you do, consider exercising those lines of credit. Jim, you really need to be able to create liquidity within your practice. And by liquidity, I mean having cash on hand. A couple other things that we've been talking with clients about right now is that some banks are looking at, if you will, a payment holiday. Maybe you can talk to them about, making it so you're paying interest only for the next few months to help conserve some cash. We've also seen this happening in some other areas too. Some malpractice providers, insurance providers, are getting information out to their customers to let them know that, hey, they're putting all payments for malpractice on freeze for about the next 60 days. So that's a way to manage cash flow and to get through this time frame. Also, we've seen some fringe benefit offerings. The companies that underwrite those, Blue Cross, in particular Delta Dental, getting out there and letting people know that, hey, there's a grace period. So encourage you to contact some of your vendors to see what you can do to work together. I think being proactive is the right way to handle it. Don't be reactive. Don't crawl into a cave. Make sure you're out there talking with your vendors, your bankers. We're all in this together, Jim. Maintaining liquidity is going to help us get through it together.
Okay, so that's on the back end, sending money out. What about on the front end, receivables and those types of activities? If other people are drawing them out, is it likely that they're going to be able to bring the cash in that they need as well?
So management of the revenue cycle is a significant issue right now for our practices. Pretty much in many spots around the country, elective cases have been stopped. Okay, so there's not many health systems that are really having elective cases being done. This is a huge issue. A lot of our healthcare providers, that's what they do, is elective cases. And really the definition of what is an elective case is quite broad. Okay, most dental practices have been shuttered here in the state of Michigan and around in other states. Also, dental specialists have been shuttered as well. With the exception of certain emergencies that can come up, they're allowed to open up to take care of an emergency. But for regular things, they're not allowed to. This has really impacted our clients in the physician space as well. We have a number of specialty surgical physicians, orthopedic, plastics, general surgeries that are not going on right now. So this is really impacting their cash flow on the revenue side. So what we've been talking to clients about is really kind of taking advantage of telemedicine. Okay, this is a technology that's been around for some time, but medical practices, for whatever reason, have not really been all that open to utilizing telemedicine. Okay, it takes away from the personal side of the physician interaction with a patient. Right now, though, Jim, there's really nothing that can be done right now in this circumstance. The practices that we work with are really now being forced to jump into telemedicine, and they're having to deal with some issues that really they haven't had to deal with in the past. It's really setting it up. How do you get telemedicine set up? How do you handle the IT side of it? What kind of software are you going to use? The documentation and the billing for the telemedicine, okay? Telemedicine for all clients is not really something that's going to work for everyone. It's not a one-size-fits-all approach, but it can work for a number of different clients, a number of different medical practices as they have just the continued patient interaction during this period of time. So that's one way to look at it as well. So another way they've been managing the revenue cycle.
Okay. Well, it's interesting you bring up the telemedicine because of the Raymond Technology Services team. They've been doing quite a few podcasts here the last week or so, and they've actually talked about the telemedicine. A lot of people out there doing it. So if there are questions, we've got quite a few podcasts that are out there, as well as you can always reach out to Raymond and we can assist you along those lines. Now, Don, switching gears here a little bit, there's been a lot of legislation that's been pushed through. What pertains to the healthcare industry that's out there that they might want to know about that they may not know?
Well, Jim, there certainly has been a lot of legislation coming through, and many of us have been really working hard to gain a solid understanding of what this legislation means to our clients. And, I think that there's a lot of opportunity out there for our clients to take advantage of it. Over the last several days, as we've been kind of thinking about all the different legislation, what it all means, the one that's really kind of bubbling up to the top is really the 3 Ps, the Paycheck Protection Program. That's part of the CARES Act that was signed into law last Friday. Okay. And the Paycheck Protection Program is the one that we're really encouraging clients to take advantage of. Okay. In a nutshell, Jim, this is a program that if you have less than 500 employees, which the vast majority of our healthcare clients do have less than 500, they'll go and meet with their banker, and they will be able to get a loan, an SBA loan from their banker equal to 2.5 times their average monthly payroll. Okay. So this loan can really help bridge the gap when things get back to normal. Okay. So when things get back to normal, whenever that happens, Jim, one of the concerns that many of our clients has is they won't have any working capital to get going within their business, within their practice, to jumpstart it, to bring employees back, to pay rent, to pay fringe benefits, to pay payroll. Okay. These are all really important things. The Payroll Protection Program will allow them to have the funds to do this. Okay. So the way that it works is that they're going to get a stream of money, and then they have 8 weeks that they can bring their employees back and initiate operations. And as long as they use those dollars on eligible expenditures, which are basically payroll, rent, utilities, very common overhead items, the loan that they received will be forgiven by the federal government, by the Small Business Administration. So this is a real significant thing to help smaller businesses keep things going into the future.
Okay. Wow, that sounds terrific. And so I think, can they start applying this Friday? Is that it? Is that the case?
Yes. It's taken a bit, like everyone, the banks have had to jump into this thing and get themselves all ratcheted up and ready to roll with this. And so applications will begun to be taken this Friday. So they're going to want to contact their bankers right now and get this process moving here, because there's going to be just a horde of businesses that are going to be out there looking to contact their bankers to take advantage of it.
Okay, great. So what else is keeping healthcare professionals up these days besides all of the turmoil going on there? Are there additional items that are out there?
Jim, there's a lot of other things that healthcare practices should be looking at right now, and things that they're keeping them up at night. One of them is making sure they understand the other act that was passed. We talked about the CARES Act and some money that they can get out of the 3P loan, the Payroll Protection Program. Another one that was passed earlier on March 18th was the Families First Coronavirus Response Act. And that's another act that they're trying to figure out what it means. In a lot of ways, it's like an extension of the Family Medical Leave Act, and many of its provisions are not applicable. There's a special exemption to healthcare providers with less than 50 employees, I believe it is. So, many of them are trying to understand that. But Jim, they're really trying to balance their HR needs right now. There's a lot of fear out there amongst not just, healthcare providers, but their staff, their employees that are interacting with patients. there's a lot of unknown issues out there, and that's causing a lot of concern within our medical practices too. People, who want to work and who can work and who are desiring to keep going at it. So that's an issue that they need to keep looking at. A couple other things that they're thinking about is that there was some recent guideline from Medicare that talked about helping medical practices and health systems by expediting funds out of Medicare. So what they're looking to do is to send medical practices money over the next 2 months. They'll front you money that can be used to offset future billing. So it's really a loan in advance from Medicare is what they're looking to do. So that's another area that Medicare is looking to help practitioners by advancing them some money to help get them through, to bridge them through these difficult times. Another area that we're seeing some action in is there's a fair amount of battlefield promotions going on out there right now. Some of the rules and regulations that we've all been conditioned to really accept have been changed. Okay, many of us have dealt with HIPAA for the past 20 some odd years right now, but with everything that's happened, they've suspended some of the rules relative to HIPAA in the telemedicine area just to make sure that patients are being taken care of. I guess practicality is something that's coming to the forefront here. Another thing too, that there used to be some rules with what's referred to as advanced practitioner providers, APPs, or mid-levels. There's been some changes in there where some of the rules have been suspended for a little bit to help these mid-level providers to be able to help and see patients. Typically in the past, the rules required a physician to be on site, to be in the clinic when these advanced practitioner providers or APPs were seeing patients. Now what we're seeing right now is the state of Michigan in particular has suspended some of those rules, understanding that, there's a strong need to have healthcare providers and that these APPs are very well trained and can handle this and really can help bridge the gap and help fill the need that's out there right now.
Okay. All right. So kind of putting the wraps on this, there's a lot of information out there, good information, misinformation all across the board. Do you have industry specific sources that you'd recommend that our clients follow?
Jim, there's a lot of different resources out there right now. And I think that where people get their best advice is from their trusted business advisors. I think that clients of ours that meet with their advisor at Raymond can really get some great advice, working with their financial institution, working with their lawyer, not being afraid to spend that time and effort to meet with your advisors, I think is really going to pay off for many of these businesses. I mentioned earlier that this situation will pass at some future time. But you know what, Jim? I really think that how medical practices and dental practices react to what's happening right now in a proactive way is really going to kind of spell out how the next 10 years of their practices is going to be. There's going to be some practices, unfortunately, that might not make it through this. Okay, the strong ones, those that are well capitalized, are going to be in a position to be very strong coming out of this. There's going to be a pent-up demand for much of the services that our clients, these physicians and dentists and veterinarians offer. And these practices need to be set and positioned to capitalize upon that when this does break.
Okay, and we're going full circle to this ideas and suggestions you started with. That's great. So, Don, I appreciate your time. If somebody has questions or comments, what's the best way to reach you?
Oh, a couple different ways to get a hold of me, but probably the best way is via email. My email address is don.mcannelly, MCANELLY, at Raymond, REHMANN.com, or they can always call me on my cell, which is 989-751-4065. Happy to help anyone out in any way to help make sure they're successful going forward.
All right, Don, stay safe and we'll talk soon. Thanks for your time.
Same to you, Jim. Take care.